This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
This morning, our Spotlight on Health is taking a look at organ transplant surgeries. I'm joined by the Surgical Director of Liver Transplants at the George Washington University Hospital, Dr. Stephen Gray. Welcome to Good Morning Washington.
Thank you for having me. Absolutely.
Now tell us, what are the most common causes of liver transplants?
Well, the most common cause of liver transplant is alcohol use disorder. Oftentimes patients, they don't realize how much they've been drinking, and they may have seen their primary care physician who tells them that their liver enzymes are elevated, or they notice that they're yellow, that the patient has turned yellow when they look at themselves in the mirror. And then that's usually the start of the journey. A lot of times with liver transplant or end-stage liver disease in particular, patients don't have any idea that they have a liver problem until they've seen their primary care physician.
Something we all know better. Is there any way to really prevent the need for a transplant?
Most important thing you can do is take good care of yourself and then drink in moderation.
Absolutely. Now talk about the importance of organ donation.
Well, organ donation is important because there are at least 25,000 people on the liver transplant waiting list, and only around 10,000 people at most are going to get transplanted in a year. And then when you add in the other organs that are needed, kidneys, lungs, hearts, there's a significant need for organs for patients who have end-stage organ disease.
So it's really a matter of making the decision for yourself and with your family.
Absolutely. I think the most important thing you can do is have a conversation with your family related to organ donation. I think the other thing that you can also do is make sure that you designate either through your state registry or at the time when you renew your driver's license that you are interested in being a donor.
Absolutely. If anyone's a little bit hesitant about that, how would you calm their nerves?
Well, I think that, the big concern when you talk to people about it, at least when I talk to my family about it, is that I'm not going to get the same level of care when I show up after a car accident or after I've had a stroke or something that is a life-threatening injury with poor neurologic outcome. And I would say that is a complete falsehood. As physicians, we are most interested in taking care of you, the patient. It's only after the time in which we are talking about end-of-life care that anybody approaches you or has a conversation with your family about organ donation.
Speaking of good care, can you talk more about the aspects that are unique to George Washington University Hospital's transplant programs?
Well, so George Washington University Hospital started the transplant programs with a kidney transplant program in 2015. And in 2022, we expanded into our liver transplant program. I think the unique aspect of GW's program is access. As you know, GW Hospital is right on the Metro line off the Foggy Bottom station. We have made that kind of the core of our philosophy when it comes to transplants, to increase access for patients in the DC metro area to organ transplantation.
A place that's easy to get to with people you can relate to because you guys speak multiple languages as well. Absolutely.
We have multiple providers in our clinic speak multiple languages and come from a diverse variety of transplant centers in parts of the country. Each of us came from a high volume center previously. Although we are currently a relatively small program, we have an extremely talented group of surgeons and physicians who've spent their careers at high volume centers previously.
Thank you for all of this helpful information and really helping us understand the importance of living a healthy lifestyle and leaving a lasting legacy with an organ donation. Thank you so much for joining me here, Dr. Gray.
Thank you for inviting me.